When someone has COVID-19, there are two different categories for that. So some people have symptoms, and for those patients, they monitor their symptoms until they resolve. They are considered to be transmissible to others basically for 10 days. And right now, the CDC just updated the recommendations to state that if you have COVID-19, you should remain in self-isolation from 10 days from the onset of symptoms and have at least 1 day without fever, and that your overall symptoms have improved before you're considered not to be at risk of transmitting infection to other people. Now, if you don't have symptoms, obviously you won't have that first day of symptom onset, and so you're supposed to use the date of your test and go 10 days from the date of that test, and then you're considered to no longer be at risk of transmitting infection to other people. So there's some pretty good data at this point where they've looked not just at the testing that we're talking about, this PCR testing, which doesn't tell you if the virus is alive or not. It really just detects fragments of the genetic material in the virus. But they've done tests with viral cultures. Those are harder to do, and that's why they're not used for diagnosis. But in research settings, they can grow the virus. And if the virus can grow, then that shows that it's at risk of transmitting to other people and causing infection. And so when they've looked at these studies, they've looked at people that have COVID-19, and they follow not only these PCR tests, but they pair it with viral cultures. And they show that in people that have mild to moderate disease, so generally people that haven't been in the hospital, those cultures don't grow past 8 or 9 days. So it gives you a little more comfort that that 10-day window is probably pretty accurate for most people that have COVID-19 disease. One of the difficulties with testing, and one of the reasons it's so confusing, not only because we have different types of tests that tell us different types of information, but the other thing that we see with PCR testing in particular is because it's so sensitive, which is helpful when you're trying to detect disease, it can also detect fragments of virus, even if the virus is dead, for weeks. And so we see people that may have some symptoms to COVID-19, their symptoms resolve, but even weeks and even months later, they may still have a positive PCR. Now, what's helpful in those research studies where they've done the viral cultures is they show that the virus is no longer growing, so they no longer have transmissible virus, but they can have detectable virus by PCR for over 8 weeks, over 2 months.